you. So, good afternoon to all. As ma'am said, today we are going to learn about basic nursing issues. I know we all nurses, we all know how to take care of the patients. We all working in the hospital. Within the hospital, we will take care of the patients. But when they go back to their homes, who will take care of the patients? So, we need to educate the caregivers. With the support of caregivers, we need to improve the quality. We can achieve the improved quality of life of the patient and their family. So this is very, very important. We have a lot of patients, bed-bound patients in palliative care. So caregivers education and about the patients in self-care and all is very, very important. So let me share my screen first. Okay. So let's see what are the basic principles of caring for a bed-bound patient. So the first one is prevent health complications. If you give a good care to the patients, even in their home, we can able to prevent health-related complications like bed sore, nutrition, feeding related problems, bowel and bladder related problems, and some if there is a psychosocial issues there, we can able to relieve that. We can support the patient family about that patient and their family. So these are the this way we can able to prevent health related complications. And if you give a proper support to the caregivers and patient in their home, so we can able to promote comfort the patients, and again along with that we can able to build their confidence level and prevent isolations. So just imagine if we for a paraplegic patients when they go back, so they usually they choose a corner side room and give the patient there. If they want to change the if they having a fully catheterization, that they need to change every month. So that time the patients go to hospital with the help of relatives or friends. So that time only they seeing around the that world. No, so otherwise they are in the one room. So that will be some sort of isolation. It will be social isolation or family isolation. So nobody is willing to see that patients. That is very, very that badly affect the patient and the family also. So we can, if we give a good care to the patients, if you provide home care support to the patient, bed-bound patients, we can able to prevent isolation. And if you do all these things, definitely we can improve. We can improve the quality of life of the patient and their family. So let's see what are the basic needs of a patient. So we all know that. So what are the basic needs? Oral care, skin care, eye care, ear and nose care, hair care, perineal care, nail care. These are the basic need of a person and their patients. Okay, so these are the basic needs. So let's see one by one. What is oral care? We all know that oral care is overall. If you provide a good oral care to the patients, that is equal to overall health. Okay, so oral care is very, very important. Study says 90% of systemic diseases are linked with oral health. Okay, so oral care is very, very important. You have to encourage the patient and empower the caregivers to give a proper oral care to the patient, especially bed-bound patients. So what are the purpose of oral care? We know, so mouth is an excellent incubator for growth of bacteria because the food particles, there is a chance of food particles accumulated in the mouth. So if you don't give a proper mouth care to the patients, that can cause mouth that infections, mouth ulcers, all those problems. So if that food particles left in their mouth, there is a chance of growth of bacteria and again cause infection. So we have to maintain proper mouth care. why we give mouth care? So we can able to prevent food particles from the mouth after eating. Then you can be able to keep the lips and mucosa soft, clean and intact. And we can able to promote comfort the patient, and we can improve the nutritional status. So sometimes if you don't give proper oral care, so the loss of appetite will be there. If you give a proper mouth care to the patients, that way we can able to improve the blood circulation to the patient, and they think that that we can able to improve the appetite level also. And we can, as I said earlier, we can able to improve the blood circulation of gums, that way we can able to maintain the healthy status of the mouth and eliminate the source of unpleasant odor. We all know that, and we can able to prevent dental caries. So these the I know you all know that few of the oral problems, but I just sharing few things which we are commonly seen in palliative care. One is dry mouth or painful mouth. So these are the one problem which we commonly seen in palliative care: halitosis, candidiasis, oral mucositis, alteration in taste, and excessive salivation. So these are the most common problems which we are seen in palliative care. So let's see what is xerostomia. If the patient is having xerostomia, it looks like this. Okay, so when we assess the patients, you have to assess this. If you see this like this, you have to make sure that this is xerostomia. And candidiasis. So if the patient is having candidiasis, it looks like this. So sometimes it could be extended to the esophagus too. So that time the patient is not able to swallow properly. So if the patient is complaining of dysphagia, difficulty in swallowing, you have to check their mouth whether the patient is having candidiasis or not. If the patient is having candidiasis, you have to give some antifungal treatment and treat accordingly. And halitosis. Okay. Mucositis also after chemotherapy and radiotherapy. Sometimes the usually most commonly the patient is having most mucositis, so you have to assess for that also. So who needs mouth care? Obviously we all needs mouth care, but few of the patients, some of the patients who needs more frequent mouth care than a normal person. One is terminally ill patients, and second one is unconscious patient. Third one is breathing through mouth patients. So terminally ill patients, unconscious patients, usually they breathe through the mouth. So there is a chance of dry mouth. So that patients, you have to give proper mouth care, that frequent mouth care, this patient. And post-operative patients, patient with infections and disease of the mouth, especially head and neck cancers. That type of patients need frequent mouth care. And the patients who are having nasogastric tube feeding. So usually, if the patient is having nasogastric tube, often neglected the oral care. So you have to give a proper education to the family members. This is very, very important. We know that the patient is not taking anything through the mouth. Even then, he or she needs frequent mouth care, because dry mouth, there are a lot of problems. If you don't give proper mouth care, there is a chance of halitosis and other problems too. So you have to give a proper mouth care. So that type of instructions and educations necessary for taking care of the patient. So how to assess? We all assess when the patient is in the inpatient department. In your settings also, you will assess the patients. Let's see what are the things for assessing the patients for oral care. The first one is cracked lips. Is there any cracked lips or dry or cotton tongue? You have to check white curd-like patches. So if there is a white curd-like patches there, you have to ask whether the patient is having any difficulty in swallowing. So if there is a candidiasis infection there, it looks like white curd-like patches in the tongue. So you have to assess for that. Any ulcers in the mouth, any redness or bleeding, and any pain in the mouth. So along with that, you have to assess pain. So pain is, we all know that pain, what is pain? Pain is what the patient says hurts. So always you have to ask the patient whether they have pain or not. And with dysphagia or change in taste of food. And the next one is any difficulty in chewing. If there is a dye mouth there, they are not able to chew properly. So that part also you have to assess. Anorexia and unpleasant smell, medication history and treatment history. So this is also very, very important. Some of the medications, the most of the palliative care medications can cause dry mouth. So you have to assess for that. And if they have a lot of problems, if you give on medications that create a lot of problems to the patients, you can think about, you can report to the doctor and think about the change of the drugs or something like that. And treatment history also. So after chemotherapy and radiotherapy, the most of the patient is having mucositis. So that can also you have to assess. So all these things you have to document it properly. So what solutions used for mouth care? We all know homemade saline or normal saline. Water is the good agent for mouth care, but in a bed-bound patient that is not adequate, you can use sodium chloride, or you can teach the caregivers how to make homemade saline. So you can take 500 ml of water and add 1 teaspoon of common salt, boil it, cool it, and keep it covered. And so in between also they can take one glass from the water from the boiled homemade saline. Then they can use that homemade saline for take care of the mouth. And you can suggest soda bicarb solution also. That part you can take 500 ml of water and add 1/4 teaspoon of baking soda. This is that some if you suggest soda bicarb solution, this is very, very important message. They can add only 1/4 teaspoon of baking soda. Same way they can boil it, cool it, and keep it covered until needed. So if whenever they need, they can take it from the bottle. So coming to the self-care education, we know all the patients are not a bedbound, but some of the patients are bedbound, but they are able to do their self-care, but they need assistance. So that type of patients we can give some sort of self-care educations. Let's see one by one. We all know brush the teeth twice a day with soft toothbrush. So you can advise for this patient also, because lot of the patient is having, most of the patient is having oral problems, and some of the patient is having oral ulcers. Maybe they might be having bleeding. So that part you can always advise the patient to use soft toothbrush. And if they have dry mouth, they complaining of dry mouth, you can give a proper education to the patient about the brushing, because if there is a toothpaste left in the mouth can cause dryness. So that part is also you have to make sure. And rinse the mouth with homemade saline or soda bicarb solution after eating. So this is you have to tell the patient. And also you have to care the tongue also. That part also you can clean with soft toothbrush. And advise the patient to take plenty of oral fluids, because if they have a dry mouth there, we can control this way. And the thing is, if they have a difficulty in swallowing there, you can check for candidiasis, and if they have a candidiasis problem, you can give antifungal treatment for that, and then you can advise the patient to take plenty of oral fluids. And also you can suggest pineapple thin layer, because the pineapple contains one enzyme called anise, that is the salivary stimulant. So you can, if the dry mouth is all the serious problem for that particular patients, you can suggest for this. But the thing is, it is acidic. If they have any ulcer, if they have any ulcer in their mouth, that can cause pain. So otherwise, you can suggest this also. And if they use any artificial dentures, the dentures there, so they can remove at night and replaced back in the morning after proper cleaning. So come to the procedure part. As I said earlier, some of the patient need assistance, but that unconscious patients, we need to give a proper that care to the patients. So how to assist the patients? So we all know that, for you just imagine a paraplegic patient, the patient is not able to take all the articles nearby. One of the caregivers or the nurse will arrange all the articles nearby and encourage the patient to take good oral hygiene, to encourage the patient to do the mouth care. Okay, so always you have to explain to the patient what you are doing. So that part you have to, adequate explanation is enough for every procedures, and provide privacy, how to maintain privacy to provide semi-fowler's position or fowler's position if not contraindicated. So I am telling all these things is, if the patient is able to do their self-care, you have to empower the caregivers and patient for doing the self-care. So sometimes, in my experience, if they are in the bed bound, like a paraplegic patient also, the caregivers will do all the care. So the care, sometimes the patient is able to do the self-care, at least brushing, even then. So the caregiver will be doing, but that time the problem is the muscle wasting. So the patient is not the patient is not doing anything. Because of that, muscle wastage will be there. Other maybe later on they are not able to pick up on the one bottle of water or anything from their on hand. So that is it's a big problem. So always you have to educate the caregivers to empower the patient as they can. So if they are able to do their self-care, they can motivate the patient to do it. And you can provide a semi-fowler's position and fowler's position or fowler's position to the patient, and place a towel under his chin and or bedding to prevent soiling of bed sheets. And as we know, pour water over the brush and place a dentifrice on it, and then you can encourage the patient to brush their mouth. After that, they can rinse the mouth frequently, and after that, you can remove and clean the equipment, wash your hands, and document the procedure. So these all things you have to educate the caregivers and demonstrate the caregivers. This is how we can do it for a bedbound patient mouth care. You have to, before discharging the patients, you have to demonstrate with the demonstrate to the caregivers. Okay, so then only they can maintain, they can go back and do the same thing in their home also. If they have any difficulty, they can contact you also. We all talk about the assistant, that the patient is able to do the mouth care, but the things is they are not able to arrange their articles. That part you can arrange the articles nearby and encourage. But if the patient is unconscious, how will they do the home or oral care in their home? So that is the next part. We in the hospital we have a artery forceps and tongue depressor. We know for an unconscious patient, they are not able to open their mouth. If you try to open their mouth in your own hand, they might be biting. So that part we can, when they go back to their home, how they can do the oral care. So instead of artery forceps or tongue depressor, we can use spoon or ice cream sticks. Or if they use toothbrush, they can remove the bristles and that part they can use. And gauze piece. If they don't have a gauze piece in their home, they can use clean cotton cloth or gauze piece for cleaning the mouth. And normal saline. If they don't have a normal saline in the hospital, we know we have a normal saline, but in their home they don't have a normal saline bottle. In that part, they can take homemade saline. Okay, we already learned how to make a homemade saline. So you can teach how to make a homemade saline, and they can make it in their home itself. And small Macintosh, if a small Macintosh is not available, they can take plastic sheets. Okay. And face towel, anyway, one towel is available in their home also. And clean water. So after cleaning with homemade saline or normal saline, you have to clean with clean the oral cavity with clean water. We can that way we can able to subside the normal saline taste. And soap sticks. If soap sticks were for applying moisturizing agent to the lips, and kidney tray for collecting the waste. So these are the articles for hospital settings and home care settings for giving an oral care to the unconscious patient. So you can take a spoon like this, and handle of the spoon you can cover it with a gauze piece or a cotton cloth. So how to do the procedure? Always, as I said earlier, you have to explain the procedure to the patient, provide privacy to the patient, and place a small Macintosh with a face towel under the head of the patient to prevent soiling of bed sheets. And you can provide semi-fabulous position and the head turned towards the side. Then take a padded tongue blade to open the mouth and separate the upper and lower teeth. Okay. So when you try to when you insert anything into their especially unconscious patients, they start bite. So they can take a padded spoon like this and try to open their mouth this way. So after opening the mouth again, they can take a same another spoon and wrapped with the gauze piece. Soak that gauze piece into the homemade saline, squeeze out of excess water to prevent aspiration of water. Then you can try to clean. So how to clean the mouth? So you can clean from the lower chewing surface, then inner side and outer side. Then you can clean the upper chewing surface, inner side and outer side. Okay. After cleaning the teeth, you have to clean. You can one side you can clean first and then move the padded tongue to the other side, and that time the opposite side will be open. That time that you can clean the opposite side of the mouth. Then you can clean the oral cavity. Oral cavity means you can clean the tongue. Okay. After cleaning with normal saline, you have to clean with normal water. So we can able to remove the normal saline taste from the mouth. So after that, you can lubricate the lips with any lubricating agent like liquid paraffin, coconut oil, ghee oil, or Vaseline. If there is any liquid paraffin or ghee oil, Vaseline is not available, you can apply coconut oil. That way we can able to prevent the cracked lips and all. So we can able to prevent dryness of the mouth also. In the lips, if there is a cracked lips there, you can apply liquid paraffin or any common lubricant oils like this. We can suggest. So we can watch next. We can watch a video on how to take care of the mouth for an unconscious patient. Then come to the next part. Go to the next part. Thank you.
Patient. Mrs. Anna is suffering from
Okay, thank you. I hope all of you get a good idea about how to take care of the patient, especially unconscious patient mouth care in their home. So you can advise and educate the caregivers for the mouth care this way. So next we can move on to the eye care. Always here one infected eye and the one clean eye is there. So we all know that we have to clean the cleanest eye first, and then you can go to the non-cleanest eye. So infected eye. So that is also you can educate. This is one of the important thing you have to educate the caregivers. For a bedbound patient, care of eye is also important. So if there is an infection in their eyes, they have to clean the cleanest eye first, and then they go to the infected eye. Okay. And always you have to educate the procedure to the patients. If you take care of the patients, you have to educate the patient, explain the procedure to the patients. Even the patient is unconscious, they can hear us though. So you have to explain the procedure, what you are going to do, that part you have to do it. And also the caregiver might be thinking that the patient is unconscious, they may not hear anything. They without any introduction, they will do all the things. That is also you have to correct the caregivers that insight also. If they think like that, you have to give a proper education to the caregivers. Right? Provide comfortable position to the patients, wash hands before and after the procedure. So to prevent cross infections, this is very, very important. Sometimes the caregivers may not in between their household works. So in between they realize that okay, need to give a oral care or eye care to the patient. Sometimes the instructions given every 4 hours only you have to give a eye care. So in between they can come and give the eye care or mouth oral care, whatever care. So this is very, very important. You have to before and after the procedure, they should wash their hands with soap and water. And also I said earlier, clean the eyelids and eyelashes with wet sops, with the wet sops. And always you have to clean from the inner canthus to outer canthus, and they can use one soap for one stroke. That way they can able to prevent further infection. And after that you have to document it well. So come to the care of nose and ear. You have to check the assess the ear also. whether the patient's ear, whether they have any ear problem like ear pain or hearing problem there. You have to assess that part, and also you have to check there is any dirt accumulated behind the ear and the front part of the ear. If there is a dirt accumulated behind the ear, that can if you don't give special attention on that area, from there sometimes pressure sore will start. So we have to check that part also. If there is a dirt there, you have to remove the dirt. And also you can give a proper nose care also. You can take a wet washcloth and remove the secretions from the nose, or you can use cotton applicator. You take a cotton applicator and soak with normal saline and squeeze out of excess water, and that part you can use it for nose cleaning. Especially if the patient is having a nasogastric tube, you have to give proper nose care to the patient. And unconscious patient also, they may not they are not able to tell you if they have any nasal secretions or nasal that crusted there. So we have to check their nose, and then if there is a secretions there, we can remove it from their nose. And also if they have any hearing problems there, if you find some ear wax in their in their ear, so please refer the patient to the ear ENT surgeon. You don't advise any. Sometimes the caregivers will be inserting any that cotton buds and some instruments and safety pins and all. So you don't encourage that things. So if they have such problem, if they have a hearing problems because of hearing that ear wax there, you can refer the patient to the ENT surgeon. And care of hair, we all know that within the hospital for a bed-bound patients, we used to give care of hair, but the caregivers doesn't know how to take care of care for a hair for a bed-bound patients. In the hospital, we know we have a rubber sheet, Macintosh and all. So if they don't have a Macintosh, they can use a plastic sheet for caring the for wash the hair. So that part we can again you have to explain the procedure to the patients. We can help the patient and move the head towards the edge of the bed and remove the pillow and protect the bed linen with the pillow cover and with the help of, with the plastic sheet. And before that pouring the water, you can insert cotton balls into the ears so that to prevent water entering into the ears. And after protecting the bed and their dress, you can again take another plastic sheet or Macintosh and keep that, make it a funnel shape, and then you can put it under the head of the patient. One corner is in the bucket, so that that all dirty water goes to the bucket. Okay, so you all know that how to do the hair wash in their bed, within the bed for a bed-bound patients. You have to teach the caregivers to how to take care, how to wash their hair in the patient bed. So after cleaning the hair, you can remove the cotton balls from the ear, and if they want to apply any soap or shampoo, you can apply anything if they, that is from the patient wishes. So if they like to apply oil or shampoo, you can apply for that, and then after washing, you can dry the hair and allow it to dry. Then after that, you can braid the hair into two, or whatever the patient likes. So come to the nail care part. So here also, this is very important in the bed bed sore part, that skin, the bed sore prevention time. So you might be hearing that nail care is also very, very important. So if they have a nail that because of the nail, if too long the nail there, they might be scratch their own skin and develop pressure ulcer. So if you apply more pressure on that same scratched area, that may be developing pressure. So nail care is very, very important. And also some sort of infections. If they have a there is a chance of dirt accumulated into the nail beds. And if they are not good maintaining good oral hygiene or that hand hygiene there, definitely that can also produce infection if they dirt enter in the stomach, and then diarrhea and all related problems will be there. And also this is very, very important. You can train the caregivers for how to do the nail care. Okay, for that you can assemble all the articles nearby, and you can protect the bed with the help of a rubber sheet and soak the finger. We all know that after bathing, our nails are nails are soft, no? So that is also you can train the caregivers. You can educate the caregivers that way. So after bathing, our nails will be soft, so that you can soak the fingers, patient fingers into the water, especially warm water, for 5 minutes. After 5 minutes, the nails will be soft, and then they can cut the nails. So when we cut the nails, you have to cut the free edges only. So otherwise, if there is an injury happen, sometimes it may not heal properly, and there is a chance of ulceration. So better you can cut the free edges of the nail only. And always you have to encourage the caregivers to provide nail care. Okay, you have to demonstrate the caregivers first, and then they can follow it. Come to the bed bath part. So bathing, we all know that bathing is very, very important for maintaining and promoting hygiene. So we can able to eliminate the waste to the skin and stimulate circulation. We can able to induce sleep. We can able to provide comfort, and we can able to the patient, give the patient of the sense of well-being and regulate body temperature. These are the objectives of bed bath. So what are the important instructions you have to give to the caregivers? Always maintain privacy and explain the procedure to the patient. You can arrange all the articles nearby, and temperature. So they can you can use lukewarm water for bed bath or a sponge bath, and only small area of the body should be exposed at a time. So this is very, very important. Sometimes the patient is unconscious. They might be thinking that they may not know anything, but they can hear us. They can sense the activities and all. So yes, only the area. If you want to clean the chest area, you can clean. You can open the chest area only. All other area will be closed with another other area should be closed with the bed sheets or a top sheet. And also you can teach the caregivers all this. They can apply soap, and they can completely remove from the body to avoid or to prevent drying effect to the body. Otherwise, dryness will be more, and dry skin will be there. So that part we can avoid this way. And cleaning the area from when we clean, we can clean the cleanest area first, then go to the least cleanest area. So but the caregivers they don't know where is the cleanest area and where is the least cleanest area. So we have to tell the caregivers upper part of the body is the cleanest area and the lower part of the body is the least cleanest area. So that part you have to tell the caregivers. And after cleaning the that upper and lower that part, you have to clean the you can immerse, you can along with the bed bath, you have to give a nail care also. So you can same water you can use for nail care also. They can immerse the feet or that hands into the water. After 5 minutes, the nails will be soft, and then you can cut the free edges of the nails. And thorough inspection of the skin is also important. When we do the skin care, like a sponge bath, you can assess the skin also, whether there is any color change or whether there is any crack or any any peeling of skin. All those things you have to assess. And after sponge bath, after caring the skin, you have to apply moisturizing cream, any liquid paraffin or any white petroleum jelly. If these things are not available, you can apply coconut oil for massaging their skin for improving the blood circulation. So back care for the patients who are prone to develop pressure ulcer, you can give back care every 2 hours. So when we do the back care, you have to give a special attention, especially on the pressure points. And lather soap with a sponge towel or the soft cloth, and wipe with soap, and just plain you can use plain water. Plain lukewarm water is good, and that way we can improve the blood circulation to the skin. And dry the area after cleaning with soap and water. You can dry the area by patting, not by rubbing. Oh, so after that drying the area, after dry that removing all wet from the skin, you can apply moisturizing cream. That will improve you can give the simple massage to the skin, that area. We can able to improve the blood circulation to the area. That way we can able to prevent pressure ulcer formation. And active and passive exercise. So within the hospital, we have a physiotherapist. They will come to they will see the bedbound patient, and they will take care of the patients. But when they go home, no physiotherapist, no nurses are there. So we have to encourage the caregivers. If the patient is able to do the exercise, we can educate the patient. If they are not able to do the exercise, we can empower and educate the caregivers for how to for doing the exercise and how to do the exercise and all. If you do the exercise, we can able to prevent contracture, foot drop and wrist drop. And we know all the joints need physiotherapy. If they are not moving their joints, the contracture will be there. Sometimes muscle wasting will be there. All problems will be there. So better they can do active exercise. If they are not able to do it, they can some assistants will do it for their improving the muscle strength. So come to the catheterization part. We all know that what is for catheterization. A Foley catheter is a sterile tube that is inserted through your urethra and into your bladder to drain the urine. If there is a retention of urine or any bladder related issues or any previous any surgery on the previous, if they are posted on surgery on the previous day, we will put a Foley's catheter, or sometimes on the day when we do the procedure, on the day we will put a Foley's catheter. That is based on their problem. So we know if you insert a Foley's catheter, that should be there till is usually 1 month is there. Every month we need to change the Foley's catheter. So let's see what are the types of catheterization. The first one is indwelling catheterization. If we that we use Foley's catheter, and indwelling suprapubic catheterization, that is also we can use if they are in the indwelling suprapubic catheter is a catheterization also, you can use Foley's catheter. And clean intermittent self catheterization, for that we can use a NEL cap. Some you might be knowing, usually in the labor room we use intermittent the NEL cap for emptying their bladder, and quantum catheterization. So these are the 4 types of catheterization which we are commonly used in palliative care and anywhere. So if there is a suprapubic catheter there, directly the catheter put a small incision on the suprapubic area, and that way we can insert a catheter into the bladder. So come to the procedure part. We all know that this is a aseptic procedure. We have to maintain a proper sterile technique for inserting the Foley's catheter. Because this is a foreign body, so if you don't mind, if you are not maintaining proper sterile technique to the that Foley's catheter insertion time, so after that, the patients will develop urinary tract infection. So we have to prevent urinary tract infection, so that we can we should maintain all sterile precautions. And you have also you have to choose the smallest size possible. Okay, so always you have to start with the 14 French catheter and lubricate. After choosing a catheter, you have to lubricate the catheter. You have to make sterile. You all know what are the steps of that catheterization. So I'm not going to detail. I just explain the important points only. Lubricate the catheter well, and so you have to in female, for females you can female the urethra is short than the male urethra. So for the female catheterization, you can lubricate the catheter. For the male catheterization, you have to insert the whole jelly into the urethra, so that the urethral canal will be having an anesthetic effect. And then if you after that 10 minutes, 5 to 10 minutes, if you insert a catheter, they don't feel any pain. Otherwise they feel pain. So for that you can insert a whole jelly, whole silocaine jelly. The silocaine jelly have a nozzle. You have to connect the nozzle into the top the neck part of the that silocaine jelly, and push all the silocaine jelly into the male urethra. After that you can insert a Foley's catheter. Okay, so we all know that after inserting the catheter, you have to inflate the inflate the bulb. So my question, how much you inflate? After inserting a catheter, we have to inflate the bulb, no? So how much water you can use for inflating the bulb? Please put your answer in the chat box. Any answers?
Request someone to kindly unmute and say their answers because there is nothing wrong or right here. You can just say your response and then we can discuss. Or else you can put it up in the chat box as well. 5 to 6.
Okay, one answer, 5 to 6 ml. Any other answers? Okay, 5 to 15 ml. Others, please respond. Okay, 5 to 10 ml. Any other answers? Okay, thank you for the answers. So better you can inflate with 10 ml. Okay, if you inflate, if you use more than 10 ml, it can cause bladder spasm. So if you use that 10 ml is enough, because if you sometimes if you use more than 10 15 ml for inflating the bulb, that bulb will be touched to the bladder mucosa and sends the bladder wall, and that after that the patients develop bladder spasm, bladder the pain after inserting the that catheter and inflating the bulb. The patients feel pain. That time, if they report like that, what you can do is you can deflate the bulb and wait for some time and then you can inflate. Okay. And sometimes antibiotics. So you most of the hospital will be introducing more antibiotics, some course of antibiotics for preventing urinary tract infection, but that is not recommended. That is not necessary. So better you can maintain a good sterile precautions. For that way we can able to prevent urinary tract infections. No need of antibiotic prophylaxis for urinary catheter insertion. Come to the clean intermittent catheterization. So for a bedbound, for a paraplegic patients, when the beginning, they may not be comfortable with clean intermittent catheterization, but after some time, if they get a sensation of the bladder, we can suggest clean intermittent catheterization. How we can do is we can again maintain privacy and wash hands. We can educate the the patient itself. The patient can the more they can themselves they can do the clean intermittent catheterization. Okay, so position comfortably based on their patient comfort. And nail cap, you can suggest nail cap 12 French and lubricate the tip before insertions. You can give silocaine jelly for that. And every 4 hours they have to they have to drain the bladder. Okay, so once they get the sensation, that sensation of the bladder, you can remove the Foley's catheter and train the patient to how to insert a clean intermittent, how to insert a nail cap. Okay, so that way we can able to prevent continuous urinary tract infection. Okay, after you using one nail cap, usually what we do here is we give on the admission time, we used to give 4 set of nail cap. So every day in the morning they can use the first one. After 4 hours they can use the second one. Again after 4 hours, they can use the third one, and then the fourth one. So after inserting, after drain the urine, drain the bladder, they can wash under running water and keep it dry and place it in a clean container. Okay, so after the fourth one, usually during the night time, they will put a condom catheter. So what are the advantages? We all know that we can in between, we can if they don't get frequent urinary tract infections, that way we can able to improve the quality of life and increase self-esteem and confidence level, and easy to use, inexpensive, and reduce the risk of infection, improve sexual life too. Okay, so these are the advantages of clean intermittent catheterization. And quantum catheterization, you all know that quantum catheterization, but the patient they don't know how to insert how to put a quantum catheter. So if you suggest quantum catheterization, you have to demonstrate it well before instructing the patients. You have to proper advice and demonstration needed for inserting a quantum catheterization. So here the advantages is less catheter associated urinary tract infection, more comfortable than indwelling catheter, less movement restriction, non-invasive, nothing inserted in the body. So no, so is externally fitting. So there is no chance of getting infection. So better you can suggest this, but some of the disadvantages also there. One is leak. There is a there is a small, medium, and large size quantum catheters are available. If you choose wrong size, it can cause leak, and also skin irritation. Sometimes allergic. Some patients allergic to latex material. So that time the patient may not be willing to wear this apply the quantum catheter. So these are the disadvantages of quantum catheterization. So here is a case scenario. Unfortunately, we don't have a patient story today also. Here is the patient story. Please read any one of the participants. Could you please read?
We need a volunteer to kindly unmute themselves and read out this case scenario for everyone.
The home care unit of the hospital made a visit and found that patient was having pericatheter leak. So they changed the catheter. The next day, the carer noticed that the pericatheter leak was still persisting. She called them again. They came and changed the catheter. Again, the next day, same happened. Once again, the catheter was changed. The catheter was changed 3 times, but the problem did not resolve.
Okay, thank you. Thank you, Niresha. What could be the problem? Anybody? Please put on your video. Pratibha, Samir, Raing, Mary, Ruby. Are you there? So, okay, nobody is willing to put on your video. Okay, tell me the answer. What could be the problem? This patient is having Foley's catheter and nurse was changed 3 times, but the problem did not solve. What could be the problem? Please unmute yourself and talk, or you can put your answers into the chat box. Anybody? Okay. Nirosha said spasm. So here is the patient is having pericatheter leak. Okay. Nirosha said maybe because of spasm. Any other answers? Okay. So here I'll come to the answers later. If you insert a catheter into the bladder, so there is a foreign body, there is a chance of urinary tract infection. So bladder care is very, very important. If they are using Foley's catheter, there are 2 different types of catheter there. One catheter means long-term catheter, one is silicone and the another one is Foley's catheter. If you use if the patient is using a Foley's catheter, they have to change the catheter every 3 weeks to 1 month. But if they are using for silicone catheter, they have to change the catheter every 3 months. Okay, so that is the difference between the Foley's catheter and the silicone catheter. And also provide perineal care. So perineal, if you don't give a proper perineal care to the patients, that can also develop also is a contributing factor of developing urinary tract infection. And also you have to give a proper advice to the caregiver. So urobag should be closed and below the waist level, and empty the bag when it is 3/4 of full. That also you can tell the caregivers. And intake of fluid. So I already said there is a chance of urinary tract infection. There is a foreign body inside the bladder. So they should take at least 2.5 to 3 liter of intake, so that we can able to prevent urinary tract infection. And also they can absorb the urine freely, and if there is any color change there, they can report us. And encourage the patient for daily bowel movement. So before in the case scenario, so this patient is having Foley's catheter and having pericatheter leak. So you can imagine that if the patient is having bowel constipation. So here is the constipation is the answer. Okay, if the patient is having constipation, the bladder, the neck of the bladder will be obstructed with the fecal matters. Okay, so that time what happened? If the fecal matters compressed on the neck of the bladder, the tube will be compressed and the urine will not be come out. So that time what happened? The urine will be leakage in the from the urethral surface. So that is why that pericatheter leak was happened there. So bowel management is also very, very important. So you can encourage the patient for daily bowel movement also. Okay, along with that, if the patient is having Foley's catheter, you have to give a proper attention to the bowel care also. So along with that, perineal care. So this is also important. If you don't give a proper care to the perineum, again infection will be there. So they have to clean the that area after urination and defecation. Clean with soap and water. For a normal person, you have to tell the patient itself. Every 3 to 4 times they have to wash with the wash with soap and water, and from you they can clean the cleanest area to least cleanest area. Okay, so after cleaning they should clean their hands. And if they for a bed-bound patients, the caregiver usually doing the perineal care. So if they do the perineal care, they can after perineal care they have to wash their hands properly. So come to the bowel care part. For a bed-bound patient, we know for lack of exercise and if there lack of privacy there and reduced food intake and some of the medications can cause constipation. So these are the things we have to keep it in mind when we take care of the patient's bowel problems. So you have to do the proper assessment for a bowel care, whether they are having whether the caregivers giving proper privacy for defecation, the patient is taking good diet and fiber containing diets, and some of the medication like especially morphine. So one of the most common the common side effect of morphine is constipation. So along with the morphine, they should take a some stimulant laxatives too. So if they don't take laxatives to the opioids, so again constipation will be there. You have to check the medication also, and encourage patient for bowel movement daily. We all discussed that. And also we can encourage to take high fiber diet and adequate fluid intake. And also exercise. If lack of exercise is also is a cause of constipation, so you have to encourage the patient to for regular exercise. If they are not able to do the exercise, the caregivers should do the exercise. And bowel care continuing, if they are using bedpans, you can demonstrate to the caregivers how to put the bedpan and all. And also they if you are using bedpan also, they can give adequate privacy to the patient. And if spurious diarrhea, yeah, after the chronic constipation, there is a chance of leaking of watery stool in the side wall of the intestine and present it as a diarrhea. The caregivers might be thinking that there is a diarrhea, but that time that may not be diarrhea. After chronic constipation, maybe spurious diarrhea will be happen. So that we can, if the caregivers report like this, you have to take a good history about the bowel, that habits and all. So whether they are satisfactory after bowel movement and all. So if they are not able to reply your questions, like unconscious patient there, you can take a good history from the caregiver side too. Okay, if they are telling like that, you can take a proper history to the caregivers and do the, if you identify, if you suspect spurious diarrhea there, or the constipation, chronic constipation there, you can do per rectal examination and find out whether there is a soft stool or any balloony rectum or a hard stool or there. So if there is a hard stool there, you can do a manual removal. After that, you can do one thing, you can do high sodium phosphate enema. For that, you can insert the suction catheter into the through the anus. As much as possible, you can introduce. After that, you can introduce to sodium phosphate enema. So after that, we can able to relieve the constipation that way. come to the nasogastric tube feeding part. So we all know that what is nasogastric tube insertion procedure. So this is also we have to teach the caregivers before feeding the patient. They have to insert, they have to wash the hands that clearly, otherwise that can, if there is an unhygienic they maintain a unhygienic practice there is a chance of developing diarrhea. And this is very important. Before feeding, they have to raise the head end of the bed, give fowlers or semi-fowlers position before feeding. Avoid prevent air entry in the tubing by pinching it. So this is they don't know how to pinch it. We have to demonstrate it and train the caregivers how to prevent air entry during feeding, and aspirate. So before that feeding, we have to make sure that whether the tube is inside the stomach or not. For that, you have to attach a syringe and aspirate the stomach contents. So if you aspirate more than 50 ml, the stomach contents means the food contents more than 50 ml there, you can skip the next feed, and then after 2 hours, you can again check the that food contents into the stomach, and then you can do the feeding. These also you can give the training to the caregivers before giving the feed through the tube. They have to thoroughly grind it and filtered. Okay, and 200 ml is advisable, and 50 ml before 50 ml clean water. So before pouring the part that condense, like any rice water or any juice or anything. So you can give 25 ml of clean water. After that, then you can give a 200 ml of prepared feed, and then again you can give 25 ml of clean water. That is total of 250 ml. More than 250 ml is not recommended. Okay, and after feeding, you have to maintain the same position at least 30 minutes. Okay, and also you can give you can give 4-hourly oral care to the patient. The patient is having nasogastric, who is having nasogastric tube, the patient, that type of patients require 4-hourly mouth care. And change the adhesive tape. So that is also very important, that you have to fix the usually we fix the nasogastric tube on the bridge of the nose, but it's not necessary always on the bridge of the nose. You have to fix the tube on the cheek of the nose, so either right side or left side of the nose. So that way we can prevent ulcer formation. So we can watch a video on catheter care, and I'll take few questions if you have.
Catheter care in females. Articles required.
Okay, thank you. So if you have any doubts, please ask.
In case no one is having any inputs or suggestions or discussion points, I think we can wind up today's session. Sheeba.
Yeah. So anybody have any questions or suggestion? So I think no questions. I know most we nurses, we know most of the things, but we have to encourage the caregivers for that daily care. So this is very, very important, especially in nasogastric feeding, oral care, that catheter care, bladder care. This is very, very important. So always before, I know within the hospital, you all take care of the patient. So when they go home, so when they plan discharge, you have to prepare the patient and the caregivers well in advance, so that they will go back to their home and they will try to follow your procedure steps and all. So if you have to give a proper rapport with the caregivers too. If they have any difficulty for caring the patients, they will try to contact you and try to manage that problems within the home itself. So this is very, very important. We have to give a proper education and demonstration before discharging the patient. This is That's why we take these sessions for the palliative care session. This is very, very important. We have, as I said earlier, we have a lot of bedbound patients. They need a proper care. They need a daily care. So without caregiver support, we can't do anything. So better you have to educate the caregivers for improving the quality of life of the patient. Okay, thank you. We can wind up the session.
So thank you everyone for joining. Just a gentle reminder that the next session is going to be our final session, and we request everyone humbly to be prepared to switch on their videos and give us productive feedbacks during that session when asked for. So with that note, this is Sripriya along with Sister Shiva signing off from the Tips Recorders. See you in the next session. Take care everyone. Bye-bye.